Are you aware that there is a new virus that's currently rapidly spreading through various parts of the world and affecting millions of people worldwide? In today's video, I'll be telling us more about this virus, what exactly the virus is, the signs and the symptoms to look out for, how the virus is spread, and lastly, I'll be providing us with practical tips on how to protect ourselves and our loved ones from contracting this virus. Hello everyone, welcome back to my YouTube channel. My name is Tia and I'm a medical doctor practicing medicine here in Lagos, Nigeria. So today we'll be talking about the hMPV infection. Now, hMPV stands for human metapneumovirus. Now, this virus is a highly contagious respiratory virus. So, when we say something is a respiratory virus, it simply means that it's a virus that primarily targets and affects our respiratory system. And like we know, our respiratory system is that system in our body or the part of our body that aids and helps us with breathing. Now, this infection or this virus has been found to affect people of all age groups, but primarily signs and the symptoms of this infection have been seen in people in the extremes of ages. So when I say the extremes of ages, it means the younger age groups, as the children will have the children, and the older age group where we have our elderly parents, our elderly uncles and relatives. Now, apart from that, it's also been found to produce signs and symptoms in people that have had their immune system compromised for one reason or the other. Now, this hMPV virus has been found to have a very short incubation period of about 3 to 5 days. So when we talk about incubation period, what that simply means is that the time frame or the period of time between when someone gets in contact or gets infected with a particular virus and the time between when the person actually now shows signs and symptoms, the person begins to show signs and symptoms of the infection. And also, it's been found that with supportive care and treatment, the signs and the symptoms of this hMPV infection begins to resolve about, or within 2 to 5 days rather of commencement of supportive treatment. Now that we have a general knowledge or a basic knowledge about the hMPV infection, we'll be looking at the route of transmission, how this virus spreads from one person to the other. Now, you remember that we said the virus is a respiratory virus. So, the primary mode of transmission is through infected respiratory droplets, and the respiratory droplets usually produce or um, by activities such as coughing or sneezing. So when someone infected coughs or sneeze, they release droplets of that particular virus. Another means of contacting the virus will be through direct contact with a contaminated or an infected surface. Take for instance the doorknob, the our tables, our handphones. So take for instance someone sneezes and or blows their nose with their hands and they touch a doorknob or handles your phone, you can actually get in contact, contract that virus by touching that contaminated surface. And another thing that also would help to increase the risk of contracting the virus would be things such as overcrowding or staying in a very poorly ventilated environment. Now, we'll be looking at the signs and the symptoms of this infection. Now, hMPV infection would show symptoms that will range from mild respiratory symptoms, such as those seen in people that have a common flu or common cold, rather, to producing overt serious respiratory symptoms in some other people. So it could include things such as cough, having a running nose or catarrh. Some people could develop fever, they could have difficulty in breathing, chest tightness, they could have wheezing. And in severe cases, people could actually have signs and symptoms of respiratory failure. But this is majorly seen in people whose immunity have been severely compromised or have a background chronic illness. Now that we've known all of this, the next thing to talk about is how to protect ourselves and our loved ones from contracting this virus. So the first thing on my list will be talking about hand hygiene. Now, under hand hygiene, I'll be talking about proper hand washing. Now, when we mean proper hand washing, it will involve us using the hand washing technique. So yes, there's actually a technique for washing our hands properly. I'll be putting up a video on that so you can go and check the video. Now, proper hand washing would involve us using water and soap, not just water. It will involve us using water and soap to wash our hands properly using the right techniques, as well as doing this regularly and intermittently during the day. Also, we could use sanitizers to disinfect our hands regularly and intermittently during the day. Another thing which I also talk about is observing and maintaining proper respiratory etiquette. So proper respiratory etiquette would look like if you have a cold and you want to cough, you do not just open your mouth, your nose, and then just cough into the public like that. So proper respiratory etiquette will involve you covering your mouth and your nose with your elbows and coughing into your elbow. So it will look up like this. So you cough into your elbow. And then if this is not convenient for you to do at the moment, you could use a handkerchief or a tissue to cover your nose and cover your mouth before you cough. Now, do not forget to properly dispose of the tissue you have used or the handkerchief in a sanitary way. Now, if you remember, we said that one of the routes of transmission is through contact with contaminated surfaces. So prevention will involve us continuously or regularly and intermittently disinfecting surfaces that we come in contact with on a daily basis. So this will include things like tables, the door handles or the doorknobs, and even our phones, because we come in contact with this several times a day. So disinfecting the surfaces of our phones will also go a long way in reducing the spread of the hMPV infection. And I also want to talk about avoiding of overcrowded environment or places that are poorly ventilated. And lastly, if you have or if you're showing flu-like symptoms or your loved ones is showing flu-like symptom, please use a mask, as this will prevent the spread of this illness to another person. Now that will be all for today. Thank you for watching. Always prioritize your health and the health of those around you. Stay safe, and I'll see you in the next video.